at Zero, we're talking to patients every day who are on the front lines of the COVID-19 pandemic. Bryce Olson is one of those patients. He's facing advanced prostate cancer. He's a dear friend of Zero, a speaker at our Zero Summit, and a passionate advocate for patients nationwide. Welcome, Bryce. Thank you so much for being here with us today.
Oh, my pleasure. I'm looking forward to it.
So here we are, we're all trying to get through this COVID crisis together, and you're going through it with advanced prostate cancer. First, tell us how you're feeling.
It's been kind of crazy, I feel like us, cancer patients have it hard enough as it is, where we're looking to try to change the outcome for us in the mid to long term. But like this COVID-19, this could have a real impact on us in the short term if we get it, because folks like me are immunocompromised, and so I'm being really hyper vigilant about my stay at home, shelter at home, type of situation, to the point where I'm very fortunate. I have a place on the Oregon coast that I escaped to, very rural here. I was living in very dense housing in Portland, 60, 70 unit condo / apartment situation. And I just felt that was kind of risky. So I escaped. I feel like I'm a little bit on Gilligan's Island here. There's really nobody else around except for my dog and my daughter, who's asleep right now. But I feel like that's what I need to do to weather the storm and try to stay safe from this thing.
So I'm curious, what additional precautions, in addition to the remoteness of your location, but I think your daughter is 12, so tween, right?
Yeah.
It's hard, right, to have with young kids. What precautions is she taking?
Yeah.
What advice do you have? Because, when you have multiple family members living with you, they sort of need to abide by some of the same precautions, the strict precautions it sounds like you're following.
Yeah, it's a really interesting question, because I guess I have an additional challenge because I co-parent her with my ex. And my ex decided to do the same thing, to kind of come over here. So she's renting a place just down the street a ways. When she came, she self-quarantined for about 7 days just to make sure that she was fine. And again, we're both like super remote. Like when we need to go grocery shopping, we're ordering groceries and having them picked up, or we don't even have to go into a store. I feel confident enough now that my kid can come and go between both houses. She's not engaging with other friends. She has one of her best friends actually is here with her family on the coast too, but he's an orthopedic surgeon. Like, he's very careful about this situation too, and especially since he has to see patients on a regular basis, he's trying to protect us as well. And so my daughter knows the severity of her father's situation, and she's been just really good about, believe it or not, even though she's 12 going on 15, she's still being really careful. And I don't know, I feel like that's good enough,
So I'm trying to think of 6 months ago, what did your treatment look like, and how have you had to change things besides completely relocating, which obviously is a huge change.
Yeah.
But I'm just curious. I mean, your cancer is very aggressive.
Right? Yeah. So I've had really aggressive, metastatic disease to the bone for 6 years. And Gleason 9, super aggressive. And I think I'm on right now, conservatively counting, my 7th or 8th line of treatment. And we don't have that many in standard of care, right? So obviously I've been doing a lot of clinical trials and experimental stuff, but largely driven based on my genomics. I'm really big on, genomically sequencing your cancer every time it starts to grow, finding out what's driving it, and then getting on the right type of either clinical trial or off-label drug that's an appropriate fit for you. But yeah, I'm on a clinical trial right now, and that's been challenging because my clinical trial is in San Diego. To be able to do that trial, I've got to do labs, I have to do imaging, I have to go into clinic, and then I have to have an infusion. And with COVID, the last time I did that was in February. I've missed 2 cycles. I recently had, as of Easter Sunday, a mobile phlebotomist come to my house to draw my blood. I had imaging on Monday done at an outpatient imaging center, not connected to a hospital. And so those diagnostic tests are now done. I'm waiting. I'm waiting with anxious. I'm just anxious about the results because I've missed 2 cycles, like I said, right? I could have let the tiger out of the cage a little bit. I don't know. But I'm at the point now where I feel pretty confident that the curve, at least for this first wave, is going to flatten here very imminently. And my plan is to head back to San Diego, either drive or charter, a little prop plane or something, and go back and start my trial again on like May 6th. And I've heard that the cancer centers now have a ton of COVID protocols in place to like really make it safe for folks like us. So I'm willing to take that calculated risk. But yeah, I mean, in summary, I decided not to go to my trial for essentially 2 months. And they were okay with that because they know that it's hard for patients to go right now, especially for someone like me who's going, interstate for a clinical trial. But my decision to play it safe might have cost me a little bit, we'll see.
Yeah, I'm curious how you made that decision, Bryce. How many conversations did you have with your doctors, your family? I saw that you did post I think a picture this week outside your house. Maybe that was the drawing the blood. I can't believe you found somebody in rural Portland to come do that, which is amazing. But kind of walk us through that decision, because you're right. It's tough. I mean, there's a lot of factors to weigh.
Yeah, I mean, it's kind of Sophie's choice, really, I think, because which risk am I willing to take? I'm very happy and optimistic that we are getting to a point where this curve is flattening, and maybe, outside of, New York, New Jersey, Michigan, Florida, I mean, there's some states that are getting really hit. But California did a really good job of sheltering in place early, and Oregon did the same. And so I'm feeling better about re-engaging with the healthcare system at this point and going back. But yeah, the calculus I did was pretty simple. I know that I could die in the medium to long term with prostate cancer, but I could die in the immediate short term if I got COVID, because I'm immunocompromised to the point where if I got this, I don't believe that my immune system could harness a response that could prevent it from getting into the lungs and causing this acute respiratory distress syndrome situation that people are in, where they have to get intubated. And you get intubated and you only have about a 20% chance of getting extubated, right? So and plus I'm on immunotherapy. That's one of my trial drugs, is an IO drug. It's an anti-PD-L1, releases the brake on the immune system so it can try to fight cancer. But we don't know, like, is somebody like me who's on immunotherapy more likely to have a cytokine storm if I get COVID, or less likely? We don't know enough about this. And so the calculus was pretty simple. I wanted to survive COVID. And even if that makes my cancer start growing a little bit more, I feel like I can reel that thing in, but I can't reel in my life if I get COVID. You know what I mean? That was the math that I did.
Thank you for sharing that. I'm also curious to hear a little bit more about clinical trials. As you know, you've been a speaker at our summit. We talk a lot about clinical trials, but patients don't know that they're available.
Yeah.
And so I'd be interested to hear more about your journey. As you said, you're on, treatment, 9, 10, or 11? I mean, So tell us a little bit about that.
I'm a huge believer in clinical trials. And the reason why, and again, not random, just throw a dart and like pick a clinical trial. I view clinical trials as not, let's test a drug on a patient. I view clinical trials as treatment, like more than the standard of care, because I think today, with our ability to understand what's driving your prostate cancer by sequencing that, and what I mean by that is, again, if you have metastatic disease and you've got a new lesion that pops up on your hip or on your rib or on your vertebrae, we have the ability today, either through a liquid biopsy, which is just looking at your blood and seeing whether the tumor's sloughing off any DNA into the blood, or through a physical biopsy where they go in with a CT guided needle and just extract a specimen. We have the ability to really understand what's driving that particular cancer. And if there are genetic mutations that are driving that particular tumor, then you can find a drug either, for prostate cancer, probably on label, no, which would mean, an FDA approved drug for prostate cancer. You're probably not going to find that today. But off label, yeah, you have a chance of finding something off label, something that was approved for breast cancer or for lung cancer, that you have the same genetic driver that you could get through your insurance if you can prove it. And then trials where they're testing all these new targeted drugs or targeted drugs plus immunotherapy. So the genomic sequencing results that you can get from a place like Tempus or Foundation Medicine, they can be extremely informative to help guide and pick a trial that would be a good fit for you. So I'm a huge believer in that. That's kind of really my whole MO, So I think that every prostate cancer patient, number one, should go the extra mile to understand what's driving their unique disease, because everybody is unique. And then use that with your doctor to decide, do I do a standard of care treatment or do I do something experimental? And open those doors.
You've been a passionate advocate for genomics. I mean, really on the cutting edge of that. I'm surprised you're not wearing your Sequence Me t-shirt.
Well, I was just thinking, dang it. Wait, I should have had that on.
We said it. We know that's the call to action that you tell patients as you advocate really around the country, sharing that. But I just wanted to see, what else you would share. Obviously now through the lens of COVID, that's probably another obstacle people are facing and trying to figure out all of that out, if they even have thought of getting sequenced.
Yeah, no, I know. So I think that, again, I do provide a lot of, useful information at sequenceme.org that explains, what this is all about and how to get access to it and why you should do it. So I'd really encourage people to check that out, sequenceme.org. But I also feel that if this is something that, a cancer patient would like to get going on, most advanced prostate cancer patients have specimens somewhere. Like even now, if they had a radical prostatectomy, that's sitting that's cryopreserved somewhere in a hospital. And I think it's really important, to not only look at the metastatic disease, but then also the original primary disease and kind of see how things have changed. And most doctors want to take a look at that anyway. So if I was an advanced prostate cancer patient right now, kind of hunkered down, sheltering in place because of COVID, I'd probably make a phone call and just say, hey, can we get that going? Could we have some genomic sequencing done on my primary tumor? And if you're stage 3 or 4, you most likely could get that and have insurance pick it up, and so I would probably do that just so you can have that data. And then I wouldn't rush into the healthcare system today to go biopsy a metastatic lesion. I just think you go there and you may walk out with something you didn't want, but I would have that on my to-do list once the curve gets flattened to a point where people feel pretty safe going back into the medical system.
Yeah, I think that's a really good suggestion. So we talked a lot about the physical, but what we're hearing from patients quite a bit is what this is doing to folks mentally. The isolation, being out of their daily lives, their comfort zone, cut off from their loved ones. Thankfully, your daughter is there. Yeah. But, just any recommendations you have? You clearly have a beautiful place to live and a great view that you shared with us earlier, but what's kind of keeping you going and how are you still connecting with folks?
Yeah, it's a great question. So I'm fortunate that I work for a company, in a corporation that is actually involved in a lot of COVID-19 related projects right now. So I'm super busy. I've been able to stay busy. I'm actually probably busier now than I've been in a long time because, we've got projects that we're, helping hospitals stand up virtual ICUs so they can help physicians not have to enter into the ICU room where the patients are and just route all that bedside data to a quarantined area where a respiratory therapist can just look at it all and stay safe. I've got so many projects like that going on right now. And I feel good because I feel like I'm adding to the goodness that's out there, helping providers stay safe and protect them from contagion. So I'm lucky that I'm keeping busy that way. I have friends of mine that have nothing to do, and because their companies really don't have that much they're not really doing much right now, and they're kind of furloughed, and they are going stir crazy, and so I don't know. I try to get out, and, I'm fortunate again because our beaches are not locked down, so I can get out and like try to get some fresh air, run my dog a little bit, try to get outside and at least pop out mentally of this COVID world we're living in, and try to connect spiritually with the environment. I feel like it keeps me sane. And I don't know. I just think that we just have to. I don't know if I really have great advice for that. I kind of feel that this is a scary time because a lot of us are avoiding the healthcare system because we want to stay safe, and that could put some of our cancers at risk. I'm very, I'm kind of in awe of some of my brothers and sisters who still go in and get treatment, and they're brave, and they're putting their masks on and going in and trying to maximize that. And I can't imagine how traumatic that must be to put yourself as an immunocompromised person, in the line of fire like that. But there's people that are a lot braver than me that are doing it every day.
Well, it sounds like that this is going to be a multi-part check-in, I hope, where we can continue to monitor your progress and share some of your insights. You've obviously got a lot of unique things going on that not all patients are facing, and I think it's really helpful to be able to share that information. So we so appreciate your time today.
Oh my gosh, my pleasure. Thanks for reaching out, and keep doing all the amazing work that you do. It's really great.
Well, we're very fortunate to have you part of the Zero community. Thank you.
My pleasure.
Awesome.